United States Senator Debbie Stabenow, the Democrat from Michigan, is on the other end of our line this morning. Nice to talk to you again, Senator.
Well, good morning. How are you?
Good. What did you think of the president's Oval Office speech last night announcing the end of combat operations in Iraq?
Well, I thought it was very appropriate. I mean, I think the most important thing for us to do is to focus on the sacrifices that have been made by the men and women who went to war for us and served valiantly for a long time. And, you know, I focus on veterans and what we can do to make sure that the health care is available that we promised. And we have dramatically increased veterans' health care, mental health help for post-traumatic stress and the brain injuries that have been signature for this war. So a lot of families in Michigan have paid the ultimate sacrifice or will live with sacrifices the rest of their life. So I was really glad he focused a lot on men and women who serve, because I think that's the most important thing.
4,400 U.S. troops died in Iraq. There will be 50,000 still left there. What will their function be, those 50,000 who remain after the combat portion is done?
Well, they are working as advisors. They're still involved in training and support for the Iraqi army, but the Iraqis now are in charge. I mean, they have their government. They are now responsible for their country, and I think this is the right thing. You know, as someone who did not support the original mission and going into Iraq because I didn't see the intelligence information as being adequate enough to do that, and both Senator Levin and I felt the same way. But once there, of course, our troops are there to do their very, very best, and they did that. And now in this role, they're serving as a support. There'll be some people there that will be, you know, backing up the Iraqis, but the combat forces are over. It's time for them to take back their country. They have stepped up, and they need to do that. And frankly, in Afghanistan, they need to be stepping up and doing the same thing.
When you say that the Iraqis are in charge and the U.S. is in a support role, you don't mean that the Iraqis are directing the U.S. troops?
No, of course not. No, but we serve a role as advisors and you know, technical support, and we'll continue to provide training and those kinds of things.
Okay. It's good to hear that. 33 minutes after the hour, United States Senator Debbie Stabenow. Yesterday, I guess more than 97 Michigan employers and unions have signed up for a new $5 billion federal program that offers assistance to help pay catastrophic health coverage.
Yes, this is a really positive, very important part of the first steps on health care reform. You know, the full access to health care, the new insurance pool for small businesses and people without insurance doesn't take effect for a few years, to 2014. But a lot of things start right away, and one of them is a provision that I authored because we have so many people that are early retired, don't qualify for Medicare, but they're retired now from their company, and they may have been retired voluntarily or not voluntarily, and they're, you know, very worried about whether or not the company is going to be able to continue to cover their health insurance. So this is a plan really for larger employers that provide health insurance to cap the cost for employers for people 55 and older, and the federal government's going to come in and pay part of that cost. It's called reinsurance, and it means that you know, up to $15,000 in costs for a year, the employer would pay. Above that, the federal government will pay the vast majority of it. So
okay, that's
you know, caps the costs and will lower costs for employers.
The Early Retiree Reinsurance Program. Senator Debbie Stabenow from Michigan, the Democrat, at 35 after the hour.